I hope you've had the opportunity to see yet more of our spoken presentations on the YouTube channel. And you've had a rest and you feel a bit recovered. We're nearly at the end of day one. So I'm really excited to welcome to you as the audience, from one legend of nursing, Damie Von Moores, to another, and that's Ruth May, who is our current Chief Nursing Officer for England. Ruth only started that post in January 19, and again, I'm sure she would say what a first year. She's the National COVID-19 Response Lead for Nursing, Midwifery and Care Professions in England. And she's led many, before that post, she's led many national projects. She was responsible for the Stop the Pressure campaign, which reduced the number of pressure ulcers seen across the region. And one of the things that I absolutely know Ruth will always say, and everybody says about Ruth, she's totally passionate about delivering and developing the next leaders. So one of the things that Ruth does so well is she nurtures the next generation, and she's got a whole work program about how we always make sure that we do that for generations to come. So it's with great delight, and I am thoroughly honoured that Ruth has found the time to take out of her annual leave, actually, just to spend some time with us this afternoon. Felt it really important to speak to you as the global audience, as the Chief Nursing Officer for England. And the other thing about Ruth, of course, is a great supporter of the foundation. Ruth was a Florence Nightingale Leadership Scholar. I never remember the year, so forgive me, Ruth, but not that long ago, let's say, and look where it's taken her. So that's amazing. Ruth, over to you, and thank you so much for joining us at the end of this, the first day.
Thank you. Hello, my name is Ruth. I'm the Chief Nursing Officer for England. So hello everyone, and I am very pleased to join you today at this very special virtual Nightingale 2020 conference. I'm delighted to hear we're joined today by colleagues from Canada, the US, India, Nigeria, China, Japan, Australia, a truly international event. It's also an event I am very sorry that we can't be having in person, which of course was what was planned when we began this year of the nurse and the midwife. COVID has meant that it's been so very different for all of us. It's affected us all professionally, personally. All of our families have been affected in one way, shape or another. And our brilliant, diverse nursing and midwifery communities, wherever they are across the globe, have consistently been at the front of the response to this pandemic. I know you've had speakers this morning talking about the need to move out of the hero, the cape, particularly the hero thinking of our profession. I agree with them. We are clinical experts. We're professional leaders in our own right. And I am pleased that in England, I've been at the table, and it's important that nurses are at the table. When I first started this job in January 2019, I had two very big priorities. One was about workforce, and the other, which was having a single collective voice. I'm delighted that in this year, the nurse and the midwife in England, we've invested in CPD, a continuing professional development, and we've invested further supporting our new student nurses and midwives. And that has seen the biggest number of future nurses, future midwives starting their professional training this autumn. I am thrilled that we are going to see a huge expansion of our workforce. I also talked about the need for a collective voice. It's really important for me that we debate, we challenge each other, we have that professional conversation, but we also come out with a single collective voice so that we are able to amplify our messages, argue for what we need to see as a profession. And I'm delighted to have seen us all across nursing and midwifery in England over this last year really articulate the value and the need and our want and our wish for our professions. But of course, 2020 has also seen that we have tragically lost some of our colleagues, some of our nurses, midwives, care workers have died during this pandemic. I stand with them, and I know you do too. Any loss to our family is too much, but I pay my respects to each and every one of our colleagues. Amidst all of this, though, we've now got an extended year of the nurse and midwife into 2021. It gives us an opportunity, I hope, to focus on the role and celebration of the work that nurses and midwives have done during this pandemic. It is, of course, it's also the 200 years since Florence Nightingale was born. A lady, a professional in her own right, that was an innovator in infection prevention and control, a trailblazer in the use of data and statistics, a visible, vital leader and role model. She put nursing on the map with her values and expertise, and they remain as important today. And it's with Florence's values and skills that are woven throughout the Florence Nightingale Foundation scholarships. And I was very fortunate to have done a Florence Nightingale Leadership Scholar, as Greta has said. I learned a lot. I learned a lot about me, my strengths, my areas that I need to develop. But one of the things that gave me a sense of belief that I could achieve, that sense of confidence and an inquiring mind. I hope that those of you that are fortunate to have any contact with Florence Nightingale Foundation, it gives you a sense of purpose, hope and confidence to further develop your career to be the best that we can. Last week in England, we announced some money for our health and well-being, our mental health support for staff in England. I 100% believe, I thoroughly believe that we need to make sure that we are well physically and mentally. And so our mental health support, our mental health and well-being is really important. No matter what role we do, we need to look after our mind and our body. And as the pandemic continues, the challenges as we go through the next few months continue, we want to make sure that all of the people that we care for, all of the people that we classify as our colleagues, have the support that they need. So please look after yourself. Please look after your colleagues. So as a profession, we can continue to grow from strength to strength. So this is a very different conference speech than I had been hoping to say and to be part of. But of course, right now, the Excel Centre is and ready to be our field hospital as the Nightingale London. I hope we don't have to use it again in the way that we did in Wave 1. But in the year of the nurse and midwife, a very personal thank you from me to you for all that you've done in phase 1, all that I know nurses and midwives and care staff will lead into phase 2 of this pandemic. Have a wonderful conference tomorrow and all the very best. And thank you for your leadership.
Ruth, as always, that was amazing. Thank you for your leadership as we face the next phase of COVID-19. Now, I have the pleasure of summing up what we've heard today, and I wonder, Ruth, if you wouldn't mind staying a couple of minutes later. You did say that you'd be happy to answer any questions, so if anybody, we've still got 150 people on the line at the moment, so if anybody wants to ask our Chief Nursing Officer for England any questions, please feel free, and my colleagues who are behind the scenes will pick out some questions to pose, if that's okay. So we're now 20 to 4 English time, should I say. So I'm hoping that the Australians have gone to bed and the US people are still around somewhere. But I really want to say thank you. Thank you to everyone who's come on this call today. As I said before, those who got up early, those who've stayed up late to be part of this conference. And before, and Ruth has just said, not the conference that we'd anticipated, but nonetheless, we've done our best. We've turned that conference that we've been planning for 2 years into this virtual conference. We didn't know how it would work out, but we've done our best. And I would say from the outset that this was our first a virtual conference. And apart from the mysterious bug that made my first few slides go round and round and round, and poor Dame Yvonne who couldn't connect, I would say so far so good after day one. In fact, more than good, it's been amazing. We've had, at one point, we had over 200 delegates online listening to our brilliant keynote speak and our panel sessions. We heard from Dame Christine Beasley about the wearing of 3 hats, but to be circumspect about trying to keep them all on the head at the same time. And we shouldn't have to, and neither should we do that. We heard from Paul Crawford about Florence Nightingale, her life, her home life, and her impact on nursing. And then we moved on to our first panel, which was our professional practice panel. And our colleagues from Australia are really mentioning about the lack of visibility about their CNO during COVID and the total visibility of the CMO. And the analogy of the public perception of nurses as superheroes and angels. And actually, we should start controlling, the nurses need to start controlling the narrative. We are skilled practitioners and we need to speak with one collective voice, a campaign that already Ruth has set going in England. We heard from Jess, the Deputy Chief Midwifery Officer for England, talking about leading compassionate leadership. And if we do that, we'll manage to deliver the highest possible safe quality care. And it will help us tackle with the work demands. And as Ruth said, we need to prioritise the health and well-being of our teams. Our regulators, we had 2 regulators. We had Andrea Ratcliffe from the UK, nursing midwifery regulator, and we had David Bentham from the USA. And actually what struck me is, and maybe it's just me, but it struck me that regulators save lives. And it's through the development of the practice standards that they set that nurses need to abide by, and not a concept I don't expect many of us would have encountered before, even thought about before. And we should no longer manage the bad apples. So regulation's not just always about the bad apples. We should shift that curve into how do we continuously assess our nurses and midwives in practice. And together we'll, as a collective, we will start regulating, not just from the regulator's point of view, but from the feet on the ground. One of the things that really I picked up on was this one professional voice. And I think our panel at that point agreed that there is one collective voice, a professional voice for nursing and midwifery. That might be so in England, but how about we set foot a social movement that we had one collective voice across the world, and we started talking. Nurses started talking, stopped talking to nurses, but they started talking to influencers, and I think it was so then we had Frances from the Liverpool School of Tropical Medicine talking about some of the issues, some of the global health issues that we face at the moment, climate crisis, Now's the right time to tackle the change and get it right. There needs to be greater diversity in global health leadership. We need to be able to manage where there are low resource environments. So how do we make sure that we can provide greater leadership in those environments? Understanding culture and context is really important when we consider improving global health. And the same issue, there is a lack of nurses' voice at the global health arena. So how can we make that better? And then we had Barbara Stilwell from the Nursing Now campaign really urging us all to read the State of the World's Nursing Report and start this campaign for improving global health. We need to talk to power and use the data to influence. And she used the analogy, just what would Florence have done? Florence would have definitely waggled that data in front of the influencers, the politicians, to make sure that they took notice of it. We heard about the national shortage of nurses across the world, 6 million by 2030. And actually, one of the things that we could start doing collectively is linking our professional qualifications, our educations, and making the case that once we do that will improve the outcomes for our patients. And that will give us the case for more specialist nurses and advanced clinical practice. And certainly something Florence would have done. She, this report has all the data in it. I remember Barbara said, and I wrote down this, that nurses are not. She concurred with our Australian colleagues. Nurses aren't the superheroes, the people flying around with capes on their shoulders, the angels. But actually, we're scientists. We're scientists that we believe in our science, and we do that through the art of nursing. And then Howard, from the amazing statistics that he's identified across the ICM membership, is the amount of nurses or healthcare workers who've died during, or who've been infected and then died during the COVID-19 epidemic. And again, what would Florence have done? There's lots of reasons to be cheerful, for certain. We are the most amazing workforce. We are the biggest workforce across the world, and we need to up our voice. If we do that collectively, I'm sure we can make a big difference together. But we've got another day of this tomorrow, and we'll hear more about how digital health can improve our patient health and outcomes. And we've got more about the impact. So what are we doing? What can we do? Again, what can we do collectively that would improve our visibility and the professional and the public image of nursing? So it's been a day full of excitement, really enthusiastic, inspirational leaders. I'm really grateful that people have given up their time to come to this conference. And as Ruth said, it's not the Excel conference centre in London, which is ready to be used as a field hospital again. That was one of the reasons we couldn't use it. But I'm really glad that we've made this effort to put this on as a virtual conference. We didn't want to lose all that intellectual content that we had from those 900 abstract submissions that we had. We wanted to do something really positive for it. So I hope you agree that it's been an interesting day, an exciting day, lots of food for thought, and we are very happy to welcome you back tomorrow. There'll be some new attendees, but if you're able to come tomorrow, that would be fantastic. We also want to urge you to join the Twitter conversation about what Florence means to you. And if you're able to tweet out any of your experiences of today, that would be great. And then very lastly, before I ask Ruth to answer any questions, I just want to remind you that you can go on to the Florence Nightingale Museum virtual tour to have a view about Florence from within your own sitting rooms or your bedrooms or your libraries, wherever you're listening from. So I wonder if my colleagues have picked up any questions from the Q&A session for Ruth. Gemma,
Yes,
are you there?
There were two.
Okay.
There were two that definitely came in. One which was, what has been the greatest challenge since taking up the role as CNO, and what's been my key learning? Well, definitely leading my profession through a pandemic. We didn't have the NHS in previous pandemics, so this is a new challenge for each and every one of us as leaders, as healthcare professionals. So yes, that has definitely by far been the biggest challenge. And my key learning, I think the early days of March, April and May were some of the hardest times of my whole life. And so the key learning was look after each other. We need time off too. And I remember when I had my first week off, I had some days off at the May half term to spend some time with my daughter. And it was really important to do that. And I needed it. So my biggest lesson was, how do we find the resilience to keep going and making sure we look after each other during that. And my second question was about truth to power. And my advice of nurses and midwives, I'm not surprised, I get asked that question quite a lot actually. And if I have one word, it would be integrity. Integrity. Always act with integrity. Sometimes it takes courage. Sometimes it's extremely hard. But my advice would just remember one word, which is integrity.
There's an additional question there, Ruth, as well.
Hi
there. Hi. I'm just wondering from one of our panellists from tomorrow, Bridie Kent, who's a professor that's been working on the impact of COVID on nurses studies, and she's asked how you are managing the competing demands on the workforce in terms of staffing, the additional hospitals and resources that we need if we do need those field hospitals.
Thanks very much, Gemma. And good question. Was it Bridie? That asked that? Yeah. Bridie, a lovely name, Bridie. I had a friend called Bridie. Bridie, thank you for that question. It's really important. We've had in the first wave, of course, we put out a call for people to come back onto the temporary register. So we had several thousands of people come back onto the temporary register willing to work. We didn't by any way need them all at that stage, but we may do going into phase 2. We also had over 20,000 student nurses step up and join as healthcare assistants, being paid a band 4, and they were a massive contribution. And my thanks to all of those people that stepped up in wave 1. We've also, of course, had a whole load of people that are internationally qualified as nurses, but over here in England weren't on the register. We had 2,500 of those step forward to join the temporary register. 1,800 of those or more have now already gone through our OSCE process and now on the substantive register. We continue to drive our retention programs to keep as many people as we possibly can, and our international recruitment is going very, very well. Over 6,500 people are wanting to come and work in England, and we will welcome our global colleagues to work in a very diverse National Health Service. So Bridie, no, it's not going to be easy. It isn't easy. We're going to need to encourage people to stay, people to be recruited, and continue to work flexibly across our professional boundaries.
There's one more, I think, Ruth, from Mike, and then we'll close the session. Thank you so much. Can you see that, or shall I read it to you?
I'm reading it now. So when professional identity is inextricably linked to the clinical area in which you work, how has the wider NHS managed the identity expectations of nurses who have moved from the normal workplace to other supporting ITs? Thanks, Mike. My God, this feels like doing a CNO interview that's live across the world. And yes, it is. It is live across the world. Mike, thank you so much. It's one of the things that I've been most proud of too this last 6-7 months, is that people have been so flexible. People have worked. I'm an ex-theatre nurse. Theatre was my background, and one day when I retire, I'm going to go back to be in theatres. But people have worked from all sorts of backgrounds and have just really used their skills to go and be refreshed in certain areas, to work flexibly in different sectors. I have been so humbled by not just people that have gone in with past ITU experience, but people that have come out of supporting outpatients and gone into the community. It's not all been about critical care. There's been a lot of work done to support inclusion health, our homeless people, our midwives that have worked in a different way. All of our professional groups have worked in a different way. So, Mike, how have we looked after that identity? I think for me, we've really come together as one professional voice in one profession, and that's our identity, is that I'm proud of nurses and midwives in England.
Thank you, Ruth. What a lovely note to finish on. Shall we finish there? Thank you, Ruth, once again. Thank you, everybody from all over the world. And we welcome anybody that would like to join us tomorrow at 09:49 GMT. So thank you and good night.